Next, we invite Dr. Bhavika for a presentation on the slit lamp versus SCOOBY duo comparison of TBUt measurement for dry eyes.
Good morning to one and all present here. I'm Dr. Bhavika Gajra from Arvind Eye Hospital, Coimbatore, resident. I'll be talking about slit lamp versus SCOOBY comparison of TBUt measurement for dry eye disease. Dry eye is a multifactorial disease of the tears and ocular surface that results in symptoms of ocular discomfort. Tear breakup time is one of the tests used to assess dry eye. It is measured by staining the ocular surface with 2% standard fluorescence and measuring the interval between a normal blink and the first appearing black spot using slit lamp with cobalt blue filter. We compare the repeatability of TBUt measurement using standard 2% fluorescent strip on slit lamp with cobalt blue filter versus SCOOBY, which stands for Smartphone Aided Cobalt Blue Ocular Photography Do It Yourself. It's an innovative tool made with incorporating ASP, which is anterior segment photography with intraocular lens with a cobalt blue filter aligned on the smartphone flash and camera and used for photographing corneas. The objective of the study was to study the efficacy of SCOOBY for measurement of tear breakup time, to compare the repeatability of TBUt measurement using 2% standard fluorescent strip on a slit lamp with cobalt blue filter versus SCOOBY. Ours was a prospective comparative randomized study conducted on 320 eyes over 4 months. The study group of patients presenting to general OPD with or without dry eye symptoms. Informed and written consents were obtained and preliminary details were noted. This is a video showing preparation of SCOOBY. The materials used were chart paper, tape, intraocular lens, cobalt blue filter sheet, hole punches, scalpel, and a ruler. A 1/8 cm strip was cut. 5 points, 1 cm apart were marked. The 3 to 5 cm section was marked, and a double-sided tape was placed over it. The distance between the flash and the camera was measured and marked over the 4 to 5 cm mark. 2 punch holes were placed. The tape was removed and the IOL was placed in the first punch hole and the chart paper was folded over. The blue acrylic filter was placed in the second punch hole. Thus, SCOOBY is made and it is aligned over the smartphone and secured with tapes. This is how SCOOBY is aligned over the smartphone. It can be customized for a particular smartphone device depending on the distance between the camera and the flashlight of the phone. The cost of making is a mere 300 rupees. The steps followed were SCOOBY is set up on smartphone. 2% standard fluorescent strip is impregnated with non-preserved saline. The cornea is stained. The patient is asked to blink to ensure uniform spread. TBUt measurement is noted in a darkroom by measuring the interval between a normal blink and the first appearing dry spot. TBUt is measured similarly on slit lamp with cobalt blue filter. 30 seconds later, excess stain is wiped off. Comparison analysis of the measurement is done and the severity of dry eye is graded. This is a video showing TBUt measurement with SCOOBY. The interval between the normal blink and the appearance of dry spots is measured. Results. The mean age of our participants was about 40 years. The median age was 40 years. There was equal distribution in terms of sex and laterality of the participants. The below table shows the comparison between mean and median values for TBUt measurement with slit lamp and SCOOBY. The values were almost similar and the difference was statistically insignificant. This is a scatter plot for TBUt measurement between slit lamp and SCOOBY. A high positive correlation of 0.97 was obtained and the correlation found to be statistically significant. This is a ROC curve for TBUt measurement between slit lamp and SCOOBY. At a cutoff of more than or equal to 10, the sensitivity was 0.97, the specificity was 0.90. Thus, we conclude that the TBUt results were comparable to that of slit lamp and as reliable. The image quality was also comparable and of high quality. There are advantages of documentation and storage of images with SCOOBY, and also these images can be used as future reference. The disadvantage is that the depth perception is compromised. But an experienced user can focus at various distances by moving the device back and forth. Thus, SCOOBY is an inexpensive, quick, convenient, portable tool. It's also cost-effective and customizable and has high sensitivity and specificity and can be used for TBUt measurement for dry eye screening and other ocular surface disorders. It's a first of its kind study. It can be used for imaging in immobile bedridden patient and in low resource settings when a slit lamp is not available. These are my references. Thank you.
So where have you used this cobalt blue light on the smartphone? Is
Yes.
it slit lamp only or something else?
No, ma'am. We've prepared a device when we've aligned it with the IOL and the cobalt blue, depending on the distance between the camera and the flashlight.
So it is the same slit lamp blue filter which you have used.
It's a acrylic blue filter sheet which is put on the flashlight, and the light emitting will give a blue filter.
Okay, fine. Okay, nice. Thank you.